So the facts, approximately 20% of our population suffering from mental illness, varying reports between 15% to 35%. That is about 50 million patients in Pakistan. Total number of qualified psychiatrists in Pakistan, 400. That means one psychiatrist per 500,000 patients. 1 million to 3 million drug addicts, 6,000 to 8,000 suicides per year, and these are probably conservative estimates. For every 100,000 patients, and this Dr. Nazila was kind enough to share these with me. She had done the calculations. For every 100,000 patients, 0.002 psychiatrists, 0.07 psychologists, so psychologists, we have a lot more psychologists, 0.008 psych nurses, 0.005 social workers, 0.002 occupational therapists with at least 1 year's experience in mental health. Challenges. Not enough professionals. I think that was right there. Inadequate facilities, as we very well know, there are psychiatric facilities that are government funded. So maybe 3 or 4 large hospitals, large government hospitals in Karachi have psych units and outpatient departments. The rest is provided by private providers, usually for profit. And then there are a few not-for-profit organizations. So inadequate facilities, lack of awareness, and we were talking about that in our morning session as well. Stigma and myths about mental illness, that obviously is a huge challenge in accessing psychiatric treatment. Difficult to access in terms of location. I mean, people living, we're talking about the larger cities. The smaller cities have nothing. We went to Gilgit-Baltistan for training maybe about 5-6 years ago, and at that time the whole of Gilgit-Baltistan had no psychiatrists at all. And then after a while they had one in the CMH in Gilgit, and I'm not sure whether he is still there. So this is for a whole province, no psychiatrists. So, and the rest of the provinces are lucky. We have some psychiatrists, but again, most of them are based in larger cities, larger hospitals. Unfortunately, a lot of people who graduate, who come to train here from other parts of the country or other parts of the province, stay in the cities. They do not go back to their own areas. Therefore, those areas remain underserved. And difficult to afford, and I think again we highlighted that, or at least we touched on that in the earlier session. If most of the mental health care is available in the private sector, as you can imagine, it becomes hard to afford for most of our people who live under the poverty line, if there is such a thing. Funding. So I put 3 question marks there because 2.4, I think Dr. Saima Hirani had also mentioned this, but these are numbers I have. 2.4% of Pakistan's annual budget is spent on health. Of this 2.4%, 2% is spent on mental health. So funding, I don't see it. Some employers provide coverage for private care. As you might be aware, some private companies and organizations, they provide medical coverage, and that includes mental health coverage. A lot of people end up going for full payment out of pocket, and then there are a few NGOs and not-for-profit organizations which also have limited capacity. Possible solutions, where do we start? So increase services in government-funded facilities. You see, everything starts with convincing people on the top that mental health is important. And I don't think that we are there yet, unfortunately. Health and education are the two probably most important sectors and the most neglected sectors in our country. So if we can't even provide basic health care to individuals, then, I mean, you have BHUs in small villages which are just lying there vacant. There is no staff. So if we can't even provide basic health care, then it's a bit hard to convince people that mental health care is important, but it needs to be done. So increase services in government-funded facilities, charity organizations, private facilities. We have those already. We have some charity organizations, we have some private facilities, then again, those are only for the people who can afford it. Community-based programs are probably one of the best solutions because of the lack of professional staff as well. Because for community-based programs, you don't have to have a lot of highly professional staff. You can have some professionals and then you can train community workers and some people with basic education to provide counseling skills, to provide awareness, to hold awareness programs in the community. So I think that that has a lot of potential, and there is community work being done, but it's not on a very organized or systemic level. It is basically being done by small groups of people or small NGOs in different areas of the country. Training more professionals, so workforce development, and obviously we've been, that's kind of seems like the obvious solution, but then it's not an easy one. We train a lot of, we do train psychiatrists here. Our Khan has a good residency program. There are training programs elsewhere, but when psychiatrists finish their training, their grueling training and their FCPS exams, they are not paid a lot even after completing their FCPS, and then hence a lot of people end up after all that time going abroad and not staying here. So we keep losing, we train the workforce, but then we keep losing them. And then another topic that we had touched before in the previous seminar, training GPs, general practitioners, family physicians to treat common and uncomplicated cases of depression and anxiety and to refer others to psychiatrists. So I think realistically speaking, the community-based programs and training GPs might be our best options right now. There are some idealistic options, but these may be the most realistic and practical options right now. But then the question is where to start, right? So again, it has to be, either some big groups, either the government-funded hospitals, the government hospitals, they have to take the initiative, or it will be up to the NGOs and smaller groups who are working on their own in isolation. And I think that's it.